Neuroplasticity is really exciting. What we know from neuroscientists and cognitive scientists now is that we have 80 billion neurons and we've got glial cells that work together to work in the blood-brain barrier to filter toxins and keep the healthy parts of the brain working. We know through exercise, real good exercise, eating foods rich in a balanced diet in omega-3 and antioxidants, and mindfulness and yoga and meditation and learning new things like a language or being able to be part of a community in a citizens group or a group like this actually can cause neuroplasticity where cells can regenerate themselves. How exciting is that? So what's good for your heart is good for your brain. So think about what your lifestyle is, and are you looking after your heart and your brain? Are you stopping those toxins from actually going through that blood-brain barrier? And if we know dementia starts 20 years before the first symptom, it's never too late. What you do in your 20s, you can manifest how you'll be in your 40s. What you do in your 50s, hopefully in my 70s, you know? So it's about looking after yourself. So this is Christine Bryden. Christine was diagnosed with dementia age 58. She was a politician analysis in Canberra for one of our prime ministers. I don't remember because they change that often. I can't remember which one. But she wrote many, many books. And she's lived well with dementia because she was enabled to get medication early that worked for her, and she was given supportive coaching from physio, OT, counselling and supporting her environment. This is Kate Swaffer. Kate is a nurse. She was a finalist for the Bethanie medallion a few years ago. She started Dementia Alliance International because, like you, she agreed there was no help for people in the community. So it's a national voice around the globe. Have a look at Kate. She's written some amazing books, and her symptoms really rely on her physical. She falls and often word-finding difficulties, but she's still at university and she still works actively in the community because she's got a supportive community. So I asked Kate and I asked John Quinn and Christine, what sorts of things can I share with families who are loving someone with dementia or caring for someone in the community? And they came up with these acronym names. So they said to them, tell them about nutrition and hydration. If we can't get enough fuel in our body and enough fluid, then we become sick. We become ketotic, which means we're burning fat, which is toxic going into the brain. That's not good. We need to have good, healthy, balanced food. As dementia advances, that can be a real challenge, and I'll talk about that in a few moments. Attitude and acceptance. We have to look at this differently, and we have to say, what can this person still do and enjoy, and how can I enable that to happen? Mental activities, music and meditation. The research shows that doing Sakudo on your own is not as good as working in a group. Doing exercise on your own is not as good as doing exercise in a group. So think about that. Exercise, any part of exercise, even chair dancing in dementia areas. I've seen people doing chair dancing. I've seen people here at Beachside doing skittles from chairs. I've seen them they're playing croquet at the moment out the front. There's so much that can be done in a community around exercise and enjoyment. And then maybe we shouldn't call it exercise. Maybe we should call it games, because that gives a more fun aspect to it. But more than anything, it's about having good sleep patterns when you can, social engagement, and setting goals for yourself. So if you are in the community now and you've just had a diagnosis, what are your names? How are you going to make sure that you live well with dementia? So there's some good food. Oily fish is also good. Sardines, tuna, salmon. Accepting people. Stages of grief. Bethanie again has amazing chaplaincy spiritual support. We have a conference happening at Perth at the moment for 3 days with our chaplains, looking at meaningful ageing and how we can spiritually support people and their families living with dementia. We need firefighters and builders. You are part of this community today because you've made the effort to come along and listen. What can you do from this conversation and show people that they matter to you. Because we don't see people, you can't see dementia. You can see a physical disability, but you can't often see it when you meet someone for the first time. But as soon as we say the word and we give the label to it, it actually ends up adding a lot more stigma. So people don't ask for help, because in some cultures, asking for help is a sense of failure. We have to change that. So people like yourselves, sharing that you got help in the community early, you're working in partnership with an aged care provider, and they actually can work if you work together and support the person.